Good morning. Welcome everyone to our monthly COVID response call. This is Edward Ng. I'm the Director of IT for the Pittsburgh Foundation. Just to let everyone know, we are recording this webinar for future broadcasts. With that, I'm going to go ahead and hand it over to Phil Koch.
Thanks, Edward. Appreciate it. This is Phil Koch, Executive Director of the Community Foundation of Westmoreland County at the Pittsburgh Foundation with the Westmoreland County Nonprofit Network. Glad to see you all here today. I'm glad everyone took time to attend. We know that these are some trying times with numbers heading a little bit back up, and so I'm sure lots of folks are eager to hear from some of our officials that are leading the response. So we're going to jump right into it. Before we start, though, I do want to send a thank you to the Westmoreland Museum of American Art that provided the artwork for us today on our title slide. In honor of LGBTQ Pride Month last month and the museum's upcoming Pride Celebration Week, July 27th through the 31st, the Westmoreland is highlighting the work of LGBTQ artists that are in the museum's permanent collection. The first LGBTQ artist featured is Lawrence Calcano, better known as Larry, an artist who gained notoriety during the area of abstract expressionism in the 1950s for his series The Black Paintings and his abstractions of the natural environment. The Westmoreland actually owns 25 of these works, paintings, and works on paper by the artist, notably Black June, painted in 1954, and Black Foam Paris, which was painted in 1955 for the series. Thank you to the Westmoreland Museum of American Art. We're going to go ahead and move right into our panelists today. We're going to hear from Alyssa Choladovsky and Dirk Mattson, who co-host these panels with us. So I'm glad they're here from the county and from the United Way. We'll also hear from Dr. Fox. Scott's here from Public Safety. We'll also hear from Dr. Conway from the IU, Lauren Hill from the Food Bank. Deb Thacker is here from Feeding the Spirit. Michelle Whiting-Zona is also here with us today, as well as John Turak from Penn State Extension. So we're going to go ahead and jump right in. Alyssa, do you have any updates from the United Way standpoint?
Yeah, just wanted to say thanks, Phil and Dirk. Always happy to be part of the call. For 211, we are seeing continued contacts there. In the past month, over 1,000 people have reached out just from the Westmoreland area to 211. Most of those calls are coming in for rental assistance. About 44% of overall calls are for housing, and about 75% of those are for asking for rental assistance. And a small number are asking for shelter and referrals to homeless shelters of that total. Also seeing a lot of calls for utility assistance, mainly for electric assistance, and also seeing a little bit of a bump in people asking about employment and particular financial assistance. So we saw the biggest spike in April. We talked about that the last couple calls. A little bit of a decrease in May, and it's been steady since then. Just looking at the numbers this morning, we are seeing a slight uptick in the past 2 weeks. So I think, people are continuing to reach out. Thanks to all of our nonprofit partners who continue to provide updates on their services and needs to 211. Also wanted to remind everyone that we are still doing the grocery shopping service for older adults and people with disabilities. This is volunteers who will take someone's grocery list, go into the store, and deliver those groceries right to the person so they can continue to stay at home where they're safest. So all that information is available on the Human Service website, the link to the number and how to request that service. So just wanted to make sure everyone realizes that's out there. Any questions, feel free to reach out to 211 or to us here at United Way in the Greensburg office. Thank you.
Alyssa, just one other quick thing. I know I'm excited that the United Way is spearheading the study a study on the human services sector in partnership with the Community Foundation and the county. Do you want to talk just 30 seconds about about that initiative?
Sure. Yes, we mentioned this again on the last call. We'll be conducting that with the Hill Group, and we'll hopefully be starting towards the end of this month once we get the agreement all in shape. But this is a human service study focusing on Westmoreland County what has been the impact of our human services on our community, where are there unmet needs, whether that's in a geographical location or with a specific population of individuals. And we're going to be putting together this study with input from our human service leadership throughout the county, and sharing the information once it's available. It'll be a guideline for United Way, for the Community Foundation, and for the county in terms of identifying where we could direct resources and just what is the status of our nonprofits. We'll be taking a look, of course, at the last couple months and what's gone on with the COVID response, how that's changed and shaped up everyone's looking towards the future of how to provide services.
Thanks, Alyssa. I appreciate that. Dirk, what do you got for us today?
Well, I want to go over a graph that has been, it's printed in the Tribune Review every day when they give the report, because at least for me, it really brought home how bad things have gotten over the course of the last 2 weeks, but certainly in the last week in particular. You'll see on the graph that we've had 1, 2, 3, 4, 5 days with 30 or more new cases. And prior to the end of June, we only had 2 days that were over 30 cases. And you can see from that graph how dense it is. I've heard from George Mizikar, and I talked on Sunday, and George talked to some degree about just how hard hit Excella has been, and probably Dr. Fox can talk about that with all the new cases that are coming in. I've also wanted to mention that we had our first death as well, and that kind of fits what the experts are saying about the deaths lagging a week or 2 behind the new cases that are coming up. I've heard that there's more deaths, unfortunately, that have happened but haven't been processed yet. So I think we're going to hear more about the deaths in the days moving forward. It's highly concerning to me that so many people are still in denial about this, that they think that this is somehow the governor's fault or somehow related to politics, or that it's made up. Because when people have that kind of attitude, it affects everybody's health because they tend not to follow the guidelines. So I just wanted to emphasize with everybody that this is real and that we need to get on board with following the protective guidelines that have been established for us. I also wanted to talk a little bit about the indicator spreadsheet. We're still collecting information from May. So that's going to be out as soon as we are able to fill in at least most of the spreadsheet. But I wanted to give you some early indicators about what we're seeing from the information that was submitted for May. The food bank and Feeding the Spirit numbers are way up, and I'm sure Lauren and Deb are going to talk about that when their turn comes up on the agenda. Domestic violence is up. Medical assistance enrollment also went up, and with all the data over 2019 and the first 6 months of 2020, it's higher than any of those months. It continues to rise, which isn't a real surprise to anybody, but it's certainly an indicator of people's needs. Community action crisis calls are also up from the previous months, and the overdose deaths were 16 in May, which is the highest of any month, again, in the last year and a half. So I wanted to bring that to everybody's attention. We're, like I said, in the process of contacting the groups that haven't submitted their data so we can have that filled in. And also collect June's data as well as best we can, though some of that data may not be able to be reported until somewhere around the middle of the month. And that's all I have, Phil. Thanks.
Appreciate it, Dirk. Thank you. And I would underscore your sentiment around taking this seriously. I know from the Community Foundation standpoint, we still are social distancing, still are not doing in-person meetings. And I would encourage my colleagues as well to start thinking about holding off on in-person meetings and continue to maintain those safety guidelines. Thank you. We're going to go ahead and move on to our next presenter. Dr. Fox, I believe, is here with us on the phone. Dr. Fox, are you here?
I am here. Can you hear me?
Loud and clear. Go for it.
So, good morning, everyone. As you heard from Dirk, we are in the midst of a uptick of coronavirus cases. I am happy to report, though, that we have a limited number of patients in the hospital. We actually have 6 patients who are hospitalized. So we are open for business. We are taking things very seriously, continuing with scrupulous cleaning, hand washing, use of PPE for our staffs. We have developed a patient concierge for individuals who are having procedures, and the concierge will help shepherd patients very safely through the system. We've developed a visitor concierge. You know, it is important, it's part of the therapeutic environment for patients that they do have access to a support person. So we are allowing 1 visitor per patient. However, it's only 1 visitor. We are tracking that very closely. We are screening visitors, taking temperatures, asking questions, and we require that they wear masks. If an individual who's a visitor is unable to wear a mask, we're unable to have them in the building. We believe that if you are someone with a medical condition that precludes you from wearing a mask, that in and of itself defines you as being at high risk yourself and really should not be in a healthcare facility unless, of course, you're seeking care. Just a little bit in terms of numbers, we have seen 31 unique patients in the month of July. Now, that's a little bit different than the numbers that Dirk has shown you this morning on the graph. We're able to look at cases that have been identified specifically by date. Some of the state numbers have to do with when the results are made available. The percentage of positive patients for our health system is 2.7%, and that's been fairly stable, but we're actually testing more people at the present time. We've tested a large number of skilled nursing facility employees and patients. Thankfully, most of those individuals have tested negative, but that does increase the total pool of patients who've been tested. Currently, our highest age group for positivity is the 25 to 49-year-old age group, and that's 33% of all individuals who have had positive tests fall into that age group. We still have our evaluation and testing center on Fry Farm Road open. It does require an appointment. You can make an appointment by dialing 1-800-727-9558. And you can call that number and they'll evaluate your situation and determine whether you need to be seen or whether you need to be swabbed, but you are able to go. We do have materials ready and available for people who need to be tested. And just to reiterate some of the other things that Dirk said, please, please, please wear a mask. When you're out of your own home or if you're at work, if you're out of your private office with the door closed, you need to wear a mask. You need to stay home if you're ill. If you have been exposed and asked to quarantine, we ask that you follow those instructions and quarantine for 14 days. Some people want to know, can I be tested and get out of quarantine? You can be tested, but that's not going to get you out of quarantine because the incubation period is up to 14 days. So if you get tested on day 3 or 4, you still could go on to develop coronavirus symptoms. So please stay in that quarantine. And if you have been diagnosed, please isolate and follow the instructions of your provider. And if anybody has any questions or concerns, please feel free to reach out to me or to their primary care physician. So that's all I have today. Thanks.
Really helpful, Dr. Fox. Thanks so much. Appreciate your time. Let's go ahead and move on over to Scott, who's here on behalf of Public Safety and Bud Mertz and his team. So, Scott, what do you got for us?
Thank you, Phil. Currently, a lot of the things are staying the same as the uptick continues. We are seeing still some needs of PPE, such as isolation gowns as being a very high demand, and N95 masks still being a little bit hard to obtain. A lot of other items like hand sanitizers and other vendors have picked up on those. Nitroc gloves and such have still been rather easy to obtain. But our tactics have still remained the same. We remain at an EOC level that is enhanced. We stepped down from the partial back in June. Right now, we're watching as our 911 calls are starting to rise. During the pandemic, whenever we were shut down, we've watched almost a 50 to 60% drop in 911 calls, mostly because there's not people out on the road and doing those kind of things. But now we're seeing the slight rise in EMS calls that are being screened for COVID-based questionnaires. And we're also seeing that police calls are starting to return back to the normalcy for Westmoreland County, which is around 1,000 calls a day. And a lot of questions that are coming in about the new restrictions that were supposed to be issued this week. There's no official order that's been issued by the governor's office. It's still been quiet. So we don't have any answers to help mitigate any of those questions that are coming up. We don't expect we just don't know at this current point in time if there's going to be more, how they're going to be laid out. A lot of people have asked if Westmoreland or other neighboring counties are going to be mimicking that of Allegheny County, and the short answer to that is no, because Allegheny is rolled under home rule, which is slightly different in the executive form of government, and they can make different calls, but at this current point in time, that there's not going to be any changes with Westmoreland until the governor says otherwise. So we're just helping get that word out, and we're also with this uptick. I'm going to reiterate the point of Dirk and Dr. Fox that yes, there's an uptick. There are still an incredible amount of people that don't believe anything is real about this. There's a lot of facts out there, and we're working to. It is real. It seems to be that it doesn't get real for a lot of people until it hits home to them. And that's fine, but we also need to keep the preventative measures out there, such as the masks and social distancing, and pushing that information out repetitively and consistently. And consistency is a big issue with this, because a lot of times we had the red, yellow, green, and the different phases and what's getting shut down. It's moving so fluidly that it's very hard for people to keep track. And so that's why we resort back to the most basic efforts of washing your hands for 20 seconds, social distancing of 6 feet, wearing a mask to not only protect others around you, but to protect yourself. And those are the key issues that are really continuously coming up. We continue to work with the local nonprofits and organizations that have any logistical requests. They have slowed down, but I expect with the uptick in numbers that they would be increasing. We still do have supplies available. We still are on top of all of our logistical needs throughout the county and the regional area. And we are in constant contact with our regional neighbors of Butler County, Allegheny, so on and so forth throughout the Region 13 and the city of Pittsburgh. If there's any questions, any type of information that people would like, Michelle's on this call as well, and I'm sure she's going to give you a great report on what's going on in the personal care homes in the region. And I'll let her at least give that good information that we're not seeing those numbers reflected at this current time into the private homes, which is always a great sign, because we'd never want to be or see again what happened in Brighton Homes in Beaver County. So thank you very much for the opportunity and the time to come here to speak. Thanks, Phil.
Scott, glad you're with us. Thanks so much. And just to underscore what Scott said, we do have some masks that are still available. So if your organization needs masks for your employees or the people that you're serving, reach out to Scott and his team. You can do that using the email address, the logistics@ email address that you can find on the county's website. And you can find that using the tiny URL at the bottom of your screen. That will take you to the county's website where you can get that information to email Scott and his team. So let's go ahead and move on to Dr. Conway, who's with us from the IU, give us an update on our education system.
All right, thank you, Phil, and I appreciate the opportunity to share a few updates. So schools continue to work on their health and safety plans in preparation for reopening in the fall. As a result of Secretary Levine's announcement of requiring masks, some districts are going back and needing to revise those plans to ensure that masks are going to be utilized by students and staff as defined in that guidance. Also, schools are preparing to not only hopefully maybe open, for as many students to be able to come back into the buildings, but also districts are planning for hybrid situations if the conditions do warrant that. Believe it or not, we're only a few weeks away until the beginning of school. And so I know educational leaders throughout the county are working diligently on getting prepared for whatever it's going to look like in mid-August and late August as we enter into the next school year. At the intermediate unit, I wanted to share that we were successful in receiving the R.K. Mellon Foundation grant, which is going to be providing internet service to families from pre-K on up through 6th, 7th grade. And Dr. Thomas, who's our student services director, is the lead on that project. So I know he's working very hard to get that set up so families as well as teachers who will be receiving professional development will start receiving those services in the very near future. Other than that, appreciate the opportunity to share and appreciate hearing all the updates from all of my county colleagues. So thank you very much, Phil.
Thanks, Dr. Conway. Appreciate it. Let's hear from Lauren Hill at the food bank. What's going on with the food bank these days?
Good morning, everyone. Thank you for having me here today to talk to you. The food bank is still seeing an increased number of households seeking assistance. Prior to the pandemic, we were serving roughly around 7,000 to 7,500 households a month, depending upon the time of the year. At the peak in April, we were serving about 9,500 households throughout the county. This is through our food pantry program, in particular, the 44 food pantries throughout the county. We're currently still far beyond that, but we're seeing roughly about 8,000 now, so still above what was pre-pandemic, but not quite at the high water mark that we were in mid-April. So we are seeing a decrease in the number of emergency food needs, meaning, the phone calls we receive that a household has no food available and they need food immediately. We are seeing a decrease in that. We're also seeing a slight decrease in the number of weekly food pantry referral calls that are coming through our office. At this point in time, only 2 of our 44 food pantries are needing our assistance with maintaining their distributions. At the beginning of the pandemic, we were taking on the responsibility of a few food pantries that were not able to continue distributing for volunteer concerns or organizational concerns, or for whatever reason they weren't able to distribute. We wanted to be sure that those families were still served. Right now, currently, we only have 2 that we are still assisting with their distributions. So still sending prepackaged food boxes to all of our food pantries through the end of the year. We made the decision that we need to just budget and plan for this through the end of the year. We're hoping that it's not necessary, but regardless, we will be prepackaging all of the food through the end of the year. Depending on how the pandemic progresses, we will evaluate if this is something that we need to continue into 2021. So far, since mid-March, we have distributed over 2 million pounds of food throughout Westmoreland County. Just a brief update on a program outside of the food pantry program. We were selected to help facilitate the USDA Coronavirus Food Assistance Program, which is the CFAP program, also known as Farmers to Families. So no confusion there with 3 different names. We are working with the Westmoreland Fairgrounds for this program. Just briefly designed by the USDA, this program was to pay food processors and distributors for excess product on the supply chain, or through the supply chain, in order to avoid food waste and then redistribute that food into household-sized packages to nonprofits to connect to folks in need. So this program was designed to be, a truck-to-trunk drive-through distribution. We are working with the Mid-Atlantic Regional Cooperative, which is an initiative of Feeding Pennsylvania for produce boxes. And we are working with Turner's Dairy for mixed dairy box items. So each household that comes to one of these distributions will receive a box of fresh produce and a box of mixed dairy items. Each distribution that we hold will serve 1,000 households. So to date, we've held 4 of these distributions, each of them at the Westmoreland Fairgrounds because of the size of the facility and the ability for us to really accommodate 1,000 households at a time. It is the most central location within the county as well. You know, we're considering, you know, if we could find another facility that would accommodate those types of cars, numbers of cars rather. You know, we would certainly entertain holding this program elsewhere, but at this point in time, logistically, that's the best option for us. We have 7 more distribution dates tentatively scheduled through October, as long as the USDA continues to support the program. So just to note, these 1,000 households that we're serving at each of these distributions are on top of the roughly 8,000 that we're seeing in the pantries. So there could be some overlap. We're not collecting any data on these folks, aside from that we have served, you know, 1,000 households at each distribution. So if anyone needs any additional information about the Farmers to Families program, please visit the event calendar on the Food Bank's website or the Food Bank's Facebook page for a full listing of days and times. So a quick note here, the next distribution for Farmers to Families will be on July 20th, that's a Monday, from 10 a.m. to 12 p.m. at the Westmoreland Fairgrounds. One last note, we did start the summer food service program this week. Delayed start to that program because of COVID, obviously, because the schools were still continuing to provide meals to students through the majority of June. We have 9 sites operational throughout the county. We have 2 in New Kensington, 2 in Monessen, 2 in Greensburg, 1 in Irwin, 1 in Jeanette, and 1 in Latrobe. A change to this program this year is that all of these meals will be grab and go. Typically, these would be congregate meals where children would sit down, have a meal. They have changed that this year to be grab and go. So students can stop by, grab the meal, and take it back to their home with them, or not even just students, but parents as well can stop and pick that up for the student. This program lasts until August 21st. And aside from those updates, we're taking each week and each month at a time, reevaluating what programming can occur, what has to be modified, and what needs to be postponed until a later date. So thank you very much for the opportunity. And if there's any questions in particular, I'd be happy to talk offline about that.
Great update, Lauren. Thank you. Sounds like you all are quite busy. Going to move on over to Deb Thackerow with Feeding the Spirit. Deb, are you with us today?
I sure am. Thank you for inviting me to come and give you an update. Like everybody is saying, we've seen an increase on all levels, except for the emergency food calls. We have had a decrease in that, the immediate food calls, but we continue with our weekly food distribution out of St. Clair Park every Saturday from 2 o'clock to 3 o'clock. And in June, we distributed 1,360 meals. So that's quite a bit. We continue to see an average of about 300 people or families come through there a week. Not always the same families that we would see at our normal Thursday evening gatherings out of Otterbein. So that tells us that there are other families and newer people in need. So we are happy we can connect with them, and we try to connect them to the other available resources that are going on. As far as housing, we've really seen an increase in crisis calls. And rental assistance is big, as Alyssa alluded to, and 211 has been doing a lot to refer to us, as has WICSI and Catholic Charities. For June, I think it was 35 families we assisted with, and we still have about 25 pending. So that's pretty high. As far as the homeless placement for June, we placed 25 individuals in a hotel for temporary emergency crisis. What we have really seen is from July 1st till today, we've had 14 emergency placements. and it's just getting into July. So that is a huge increase, and we're really keeping our eye on that and working hand in hand with Welcome Home, Blackburn, and Union Mission to try to get more permanent housing after we place them temporarily. That is about it for us. The one other thing we are looking at is obviously the weather is going to turn in October, November, and we're looking at other spaces to hold our weekly meal distribution as a takeout. We are looking at maybe going back to do that at Otterbein Church if we can do it safely and within the guidelines of social distancing and masking. So we will come to that decision probably by the end of July, and we'll keep you updated on that. If anybody has any questions, they certainly can contact us. Thank you.
Thanks so much, Deb. Appreciate it. Michelle, on to you for an update. I know we're going to hear a little bit about the nursing facilities, it sounds like, but I'd love to hear your update.
Good morning. Thanks, Phil. Hi, everyone. I am not the executive director of anything. I want to point that out.
You just gave a promotion, that's all.
Yeah, thanks. I hope that comes with a raise, Phil. So I'll report on two things today. The first thing I want to report on is a little bit of good news. You know, there's a lot of negativity, but the state had mandated that all nursing facilities have to mass test by, in mass is MASS, test everyone in the facilities by the end of this month, so 7/31, and then everybody has to, in the personal care homes, mass test by the end of August. So a lot of the facilities, a lot of the nursing facilities have done the testing, and the good part is nobody is sick. Everybody that has tested positive is asymptomatic. So that is a really good thing. And the numbers are very, very, very low. I haven't added up and done the statistics, but it's low. So that is a positive thing. The reason why Dirk invited me today was for the homeless sheltering. And we talked about this several months ago. And we've had a little bit of issues with people calling and, you know, we need to house these people. There are rules and guidelines for the housing assistance for COVID positive or assumed positive or somebody who's been in contact with somebody. The first rule is you have to have had contact with the person. The second rule is you have to have a test. So the rules that are implemented by FEMA are: you're exposed, you get a test, we can put you in the isolation hotel. When your test results are received, if you are negative, you are out of the program. If you are positive, you will remain in isolation in the hotel for the 14 days and you'll be retested. And until you test negative, you can stay in the shelter that we have supplied for you. But the testing is the key. Just being exposed is not enough. And unfortunately, as we all know, you know, as we heard Dr. Fox say, sometimes you're not symptomatic, you know, you really don't develop the testing level that you need in 3 days. It's 14 days or, you know, whatever the date is, 7/14. So it's a catch-22 situation for us, but the rule is we have to test. So with that being said, we are having a meeting again tomorrow morning to try to fine-tune this a little bit and maybe pull out some other resources where we could isolate people without the testing being required. We just don't know about funding for that. Dirk is aware of that. It's a funding issue for us. So we are going to meet tomorrow morning and try to work that out. The center that we contracted with, they are still willing to accept any person that we would send there because they have had cancellations and everything because of the COVID. So that's not an issue. It's a funding issue and we have to follow the rules. So if anybody has any questions for me, I am now working as the Access and Functional Needs Recovery Specialist at Public Safety. Just go ahead and give me a call and or email me or whatever you need, and I will do anything I can to help you. So reach out, and it was nice to talk with everyone, and have a great week.
Thanks, Michelle. And once again, I apologize for messing up your slide there. We'll get it right at one of these days. I want to go ahead and move on over to John Turak, who's here from Penn State, from Penn State Extension. I do want to make a quick note before he begins that there is a handout that he wanted to share with everyone. There should be in your control panel, you'll see we've put the handout in the control panel. There's a way in which if you click on it, you can download that handout. So I just want to make a quick note that you might want to explore that while John is giving us information. So John, I'm going to send it over to you.
Thank you, Phil. Also have Tom.
John, you're a little bit quiet. I'm not sure if there's a way in which you could move in or something along those lines.
How about now?
Still a little bit quiet. Just if you use the loud voice, that'd be great.
How about now?
Much better. That's great. Thanks, John. Appreciate it.
Okay. Tom Beresnack is with us also, but he's on listen only mode. He was going to present with me, but I don't know if he got the right link. If you would go to the next slide. We should have a slideshow available here too. There we go. My presentation is mostly about getting connected with Penn State Extension. I am a community development assistant, as Phil said early on. Penn State Extension has much more than that, and I'll show you that. I do encourage you to download the handout and take a look at it. Throughout this presentation, there are links that you can click to more resources that we have available. We're normally based at Donahoe Center, Building 214, but we're working from home at this point, and we are still available online or by phone call. Our soil tests are still available there, I guess, if you need them through a mail-in option. So next slide. I did mostly want to show you our website up front. This is the way that folks can access us. We offer a lot of different guidance in different areas. A lot of the other folks talked about the food situation across the county and resources that are available. That's often what folks know us for, but we have many more resources. If you go to the website and where it says, what do you want to learn about, you can click that, type in anything that you want to learn about, and we probably have some sort of resource documents that people can utilize. Next slide. Say a question, and that's good right there. What makes a good community? I'm a community development educator, so that takes you to a handout that really talks about, from a community development standpoint, or if you want to improve your community, some resources that we have. And go ahead to that next click. Up at the top of the website is a menu bar and also a search option. And when you look at that, you can see there are multiple areas that we have experts in: animals and livestock, forage and food crops, trees, lawns and landscaping, pests and diseases, forest and woodlots, food safety and processing. And I wanted to highlight that. We've seen a really big uptick in gardening this year, and we'll be coming up on a time when there'll probably be a lot of food that folks have that, all right, what do we do with this now? If you want to learn how to can, that's one of the expert areas that we have. If you have pests and diseases in your garden leading up to this, that's something that you can come to us for. If you have water challenges, we have a lot of water places. We have experts in water quality and testing your well water, that sort of thing. Energy issues, if you're thinking about going to solar or renewable energy in some way, or even natural gas, we have experts in that area. Businesses and operations, we've partnered with Penn State New Kensington and the Corner Launch Box there. We delivered a training yesterday on, say you want to start a food business. There's a lot of folks looking at how they transition in this economy right now. We come to us for that. If they're thinking about a food business, we have quite a number of experts in that area. If you're thinking about selling your local produce that you're growing at a farmer's market. We can help you learn about that. And community development, again, those are some of the areas that my team is focused in, and that's where I have more resources in the rest of this presentation on community planning and engagement, economic development, urban forestry. Vandergrift is working on creating a tree commission right now. We've been assisting them. And land use questions, how to interact with your municipality. Next slide. We also have a considerable amount of resources dedicated to coronavirus. If you're not directly in Westmoreland County or right over the border, we have an office in every county. You can find your local extension office and educators. That's how you access our local experts. And if we don't have one in each county, we have someone somewhere in the state can assist. When I mentioned the corner launch box programming, we had Linda Falcone presenting yesterday on starting a food business, and she's based in Susquehanna. Next slide. This is my team. We've seen a real uptick in walking and getting outside for exercise. So that we have a land use webinar series coming up next Wednesday. We have Patrick Wright from PennDOT talking about pedestrian safety, speed issues, crosswalk issues in communities. So if your community needs any kind of guidance, come to this webinar series. Also, the future of zoning, what that looks like from the COVID-19 lens, how communities might transition as we move forward. Farmers markets before, during, and post COVID-19, another topic that's relevant right now. What to look for in a planning commission zoning hearing board member if your community is looking to do more planning for the future. And also changing consumer food sourcing in COVID-19. In the COVID-19 pandemic, early on, we saw a lot of supply chain issues. As we saw the empty shelves in the grocery stores. The system is still adapting to that, so we're going to be taking a look at those issues. Who should attend? Pretty much everybody, but those are our targeted folks that would really benefit from this. Next slide. We have a program coming up tonight that Dirk is one of the panelists for, getting connected with nonprofit services and opportunities. It's for a general audience. Say you want to help your community or whatever it is you're interested in. This is a webinar that teaches you about what's out there, the wide variety of types of nonprofits that are available, and how you get engaged either as a volunteer or perhaps even as a leader. If you click that link, you can register to attend, and that's this evening. So I encourage you to do that as soon as possible. Next slide. And again, we have, these are the panelists for tonight. You can see the breadth of experts that we call on outside of Extension. We act as a convening entity. Pennsylvania Association of Nonprofit Organizations, United Way of Pennsylvania. And then we have some regional representation with the Community Action Agency in Union Snyder County, Dirk from here in Westmoreland County, and Hispanics in a Hispanic community. Manos Unidas in Adams County will be presenting. Yemi Gagliardi. Next slide. And we have written publications. We have probably been hearing about broadband connectivity. We have a number of articles that talk about that. We also have emergency response to COVID-19 for nonprofit organizations, a number of resources there. Pennsylvania Communities Innovate, it's another article. Emergency response resources for local elected officials. We encourage any council member that you know to go to that site to access resources that they may need, including how to have a meeting. That's been a challenge in a lot of cases with social distancing and not being able to meet face to face. We have a broadband map that talks about where broadband is available or not available, and we've kind of been at the forefront of improving that situation. Also, Farmers Market Finder map. If you want to know where your local farmers market is, or if you want to put your local farmers market on this map, that's there. Brian Moyer is kind of our guru for farm markets, so if your community needs to know how to set up a farmer's market safely, we have guidance sheets on that. If you need resources, we have an online grant writing course. Our courses that do have a fee are currently at 50% right now, so that's an opportunity that's available. And working with volunteers, if you need, if your organization needs guidance on managing or getting more volunteers to come to your organization, that's a handout that's available for that. Also, developing leadership on your organization. We have a training for that and lots of resources. Next slide. That's just a pamphlet with our other standard brochures, our standard programs beyond COVID-19 response. Encourage you to download that, take a look at it. Next slide. That's how you contact me. And next slide. Some of our other team members. Next slide. And again, our website specifically for community development, but I encourage you to explore the greater website for any of the other issues that you might find you need guidance on. We have experts in pretty much every field that you can think of. And thank you. I think that's the last slide.
Great. Thanks so much, John. Appreciate your time and for sharing those resources. Once again, if you need to go back and see some of that again, you can go ahead and download that presentation in the handouts section of your screen. So feel free to do that now if you haven't done so and need that resource. Before we close out today, I just want to loop back around to see if Dirk or Alyssa have anything else that came up for you as we were going through the presenters.
No, I was just going to ask if there's any commissioners or chiefs of staff on the line that can speak to the CARES Act. Maybe we can give them an opportunity to speak now.
I don't see them in the presenters column there, so I'm thinking that they weren't able to join us today. But to your point, Dirk, I would say that I know that I've reached out to them as I know that you're in contact with them as well, and I think as soon as we have information on how the CARES Act funding will be distributed, I know the Community Foundation is interested in hosting a separate call, information session just about that, and I've certainly put that out there to folks so that we can be as clear and transparent on how that process will work. So we're going to work hard to make sure that the county is clear about that and that we can disseminate that information as it comes about. So Dirk, I'll look to you to help me figure that out.
Happy to. Thank you. I don't have anything else.
Great. Alyssa, do you have anything else for us?
Nothing more from me. Thank you.
Okay, great. Great. Well, thank you all for your time this morning, and let's keep working together. Once again, we have one more of our monthly calls that are scheduled for in August. If it seems that that things have shifted dramatically and we need to increase the number of calls, we may schedule something between now and August, but right now the next call will be August 13th at 8 a.m. Unless you hear from us otherwise. So thank you very much, and let's keep working together. Thanks.
Thank you.